Hi, I'm Dr. Sheryl Martin-Schild. I am your statewide stroke medical director for the Louisiana Emergency Response Network. Today, we're going to talk about everything you need to know about stroke. The Louisiana Emergency Response Network, or LEARN, is an agency of state government created by Louisiana legislature in 2004. LEARN is charged with the responsibility of developing and maintaining a statewide system of care for patients suddenly stricken by serious trauma or time-sensitive illness, such as heart attack and stroke. Getting to the right place at the right time to receive the right care is a matter of life or death for these patients. Stroke is the number 5 killer in the United States. About 800,000 strokes occur each year. This means every 40 seconds, someone in our country has a stroke, and every 4 minutes, someone will die of a stroke. Stroke is the number 1 reason for adult disability and the number 1 reason for nursing home admission. The healthcare expenses related to stroke are in the billions annually, and this is predicted to get worse. Treatment in a stroke hospital is necessary to have the best chance for a good outcome. The LEARN Board recognizes 4 levels of stroke centers. Level 1 centers are comprehensive stroke centers. Level 2 centers are primary stroke centers. Level 3 centers are acute stroke-ready hospitals. Level 4 centers have attested to being stroke bypass hospitals because necessary services are not available 24/7. The goal is to get patients to the fastest Level 1, 2, or 3 center. Not all hospitals have the capability of evaluating a patient with suspected stroke within the time frame necessary to get the patient treated fast. In addition to 24/7 staffing of an emergency room, rapid CT scan availability, and rapid laboratory turnaround time, a stroke treating hospital must have organized protocols for evaluation and treatment, access to a neurological expert, an agreement with a hospital capable of providing a higher level of care when needed, and participation in quality control programs. The number 1 driving principle with access to care for stroke is getting patients to a facility where proven treatments can be offered. LEARN's ongoing development of Louisiana's statewide stroke care system is guided by the evidence-based hub-and-spoke model that facilitates widespread patient access to life-saving care and treatment. Treatment begins at a spoke hospital, and then transfer is facilitated, when necessary, to a hospital providing a higher level of care. Louisiana's hub-and-spoke model includes comprehensive stroke center and primary stroke center hubs and spoke hospitals connected by telemedicine. There are treatment options. Treatment options include tissue plasminogen activator, TPA, the clot buster, and only FDA-approved medication for treatment of an occlusive stroke within the first few hours. More than half of Louisiana hospitals can provide TPA to appropriate patients with stroke. Recently, clinical trials have proven the effectiveness of a clot-removing procedure, which requires specialized physicians and equipment and is not widely available. Now, more than ever, getting patients to the right place in time to minimize the devastation of stroke is necessary to reduce the long-term disability from stroke. Unfortunately, Level 1 and Level 2 hospitals cannot currently provide the emergency care to many patients across the state. We are dependent on Level 3 or acute stroke-ready hospitals to have the experience and access to neurological expertise to get patients treated and then make a decision about whether the patient should stay at the Level 3 hospital or be transferred. In some cases, this is dependent on access to an intensive care unit or neurologist. In other cases, it is because the patient needs neurosurgery, specialized procedure for clot removal or aneurysm treatment, or may benefit from a dedicated stroke team or clinical trial. Now we'll review the symptoms and signs of stroke. Stroke presents with sudden loss of function. 1 minute, everything is working. Then suddenly 1 or more functions are lost. This is because of sudden disruption in blood flow to part of the brain. The classic symptoms of stroke include, number 1, loss of vision. Common patterns include loss of vision in one eye, as if the eyelid is shut, double vision, when images from the 2 eyes can't line up properly and 2 images are seen instead of 1, or loss of vision in 1/2 or 1 quadrant of what is normally seen. Usually, each eye will have the same part of the vision lost, the right side or the left side. Any sudden loss of vision is a stroke until proven otherwise. Another common symptom of stroke is the loss of ability to communicate effectively. This may include trouble articulating words, with words sounding slurred. There may be difficulty expressing words and ideas. There may be trouble understanding words. There may be trouble with reading or writing. Any sudden loss of communication is a stroke until proven otherwise. Another common symptom of stroke is loss of strength, such as involvement of one portion of the face. This may involve the arm or the leg, or both. Any sudden loss of strength is a stroke until proven otherwise. Another common symptom of stroke is loss of sensation. This may involve the face, arm, or leg, or some combination, but is usually on one side of the body only. Stroke doesn't usually cause pain. It causes loss of a function, such as numbness. Any sudden loss of sensation is a stroke until proven otherwise. Another common symptom of stroke is loss of coordination. This may be noticed as clumsiness or difficulty walking. This is often described as feeling like the body is drunk when there's been no exposure to alcohol or drugs. A person may knock things over, stumble and fall, or stagger or lean to one side. Any sudden loss of coordination is a stroke until proven otherwise. Sudden severe headache without a known cause may be a symptom of stroke. Any sudden new headache could be a stroke, particularly if associated with neck stiffness or pain, nausea, drowsiness or sleepiness, light sensitivity, or loss of vision, communication, strength, sensation, or coordination. Any sudden severe headache without a known cause could be a stroke, and the most lethal type, hemorrhage, which is bleeding on the brain. Everything you do is because your brain makes it happen. Every part of the brain has its own special function, and every part can be affected by stroke. Therefore, any sudden loss of function is a stroke until proven otherwise. Stroke is an emergency. 911 should be called for any symptoms or signs thought to represent a stroke. When an artery is broken and there's bleeding into the brain, the most common cause is very high blood pressure. The blood pressure must be lowered fast in order to reduce the pressure on that broken artery and reduce the amount of blood inside of the brain tissue. Sometimes the bleeding is related to the use of blood thinners. In this case, there are treatments which must be given fast to reverse the effects of blood thinners to reduce bleeding. Sometimes the bleeding is caused by an aneurysm that broke inside of the brain, requiring specialized procedures to secure the aneurysm and prevent further bleeding. Sometimes surgery is necessary to prevent loss of life. These treatments need to be provided fast. When an artery is blocked by a blood clot, brain cells cannot survive very long in the absence of blood flow. Every minute during a stroke, up to 2 million brain cells die. In order to minimize damage, the blood vessel needs to be opened, but this must be done quickly. With every minute that passes, a larger amount of brain tissue dies, and a smaller amount of brain tissue could recover if the artery is opened. After a few hours, it doesn't matter if the artery is opened or not. The damage has been done. Treatment in the first hour is associated with a substantially better chance of life with minimal or no disability compared to treatment in the second hour and later. Treatment needs to be fast. For any sudden loss of function, call 911, and transport should be to the closest Learn Level 1, 2, or 3 center.